Today, I will continue talking about the healthcare in the US. And with a mini story, you will practice your speaking. It's like talking to another person in English. You'll see, it's fun.
Welcome to Speak English Now podcast with your host, Georgiana, the podcast that will help you to speak English fluently with no grammar and no textbooks.
Hi, I'm Georgiana, your English teacher. Thanks for joining me for a new episode of the Speak English Now podcast. If you want to help, please share the podcast on social media. That would mean a lot. Thanks. Before we start, visit my website, speakenglishpodcast.com, and subscribe to my free mini course. In the next 5 days, you will discover how to enhance your English fluency. Okay, let's start. Healthcare insurance in the US has a long history. However, the earliest forms of healthcare insurance in the US were largely private plans that covered hospital and medical care for individuals or employers. Today, most Americans obtain health insurance through their employers or government plans such as Medicare and Medicaid. In today's episode, I will start by talking about the private healthcare system. Private care in the US allows individuals to purchase health insurance coverage from private companies instead of relying on public insurance sources like Medicaid or Medicare. Most private health insurance plans are offered through employers and are known as employer-sponsored health insurance. Private health insurance usually covers a wide range of healthcare services, such as doctor visits, prescriptions, mental health care, hospitalization, and emergency care. Depending on the plan, private health insurance might include coverage for vision and dental care, alternative medicine, and other services. These plans can vary significantly in cost and coverage, from basic plans that cover essential services like doctor visits and prescription drugs to more comprehensive plans that can cover costly treatments like surgery. In addition to health insurance, there are several options for accessing healthcare in the US. You can access healthcare through community health centers or free or low-cost clinics if uninsured. For instance, the Health Marketplace is a resource where people can shop for and purchase health insurance coverage. It provides access to various health insurance plans, including private and Medicaid and the Children's Health Insurance Program. It also provides information about subsidies and tax credits that can help reduce the cost of premiums. Furthermore, financial assistance programs are government and non-government programs that provide people with financial help. This can include grants, loans, tax exemptions, and others. These programs can provide short-term help for people in need or long-term assistance for individuals facing chronic financial hardship. As you can see, the U.S. healthcare system can be challenging to understand. So if you plan to live in the U.S., you will have to research different health insurance plans and options to ensure you get the necessary care. Perfect! Now let's continue with a mini story so that you can practice your spoken English. I will tell a story by asking simple questions. I use this technique extensively in my premium courses, as it is highly effective. First, I say a phrase with information. Next, I ask some questions. After each question, there is a pause. It's your turn to answer. After each pause, I give a correct answer. That's how I build the story. And if you want to improve your fluency much faster, check out my premium courses on my website, speakenglishpodcast.com/courses. There are several levels. Okay, let's start. A young math teacher named Matt was taken to the ER by his students. What was the teacher's name? Todd? No. The teacher's name was Matt. Was Matt an astronomy teacher? No. Matt was a math teacher. Was the teacher young or old? Young. The teacher was young. He wasn't old. Did the students call an ambulance or a limo? An ambulance. They didn't call a limo. The students called an ambulance. Who took Matt to the ER? His butler? No. His students took Matt to the ER, not his butler. Did Matt's students help him get to the ER or the beach? To the ER. Matt's students helped him get to the ER, not the beach. The nurse looked at Matt and saw he was smiling strangely, so she became concerned. Did the nurse ignore Matt? No. She did not ignore Matt. The nurse looked at him. Was the nurse concerned or indifferent? Concerned. The nurse was concerned. She was not indifferent. She was concerned. Was Matt smiling happily? No. He wasn't smiling happily. He was smiling strangely. Who got concerned? Matt? No. The nurse got concerned, not Matt. Was the nurse smiling? No, she wasn't smiling. She was concerned. The teacher laughed out loud, making everyone in the ER laugh along with him. Did anyone begin something? Yes, the teacher began to laugh. Was the teacher laughing or crying? Laughing. He wasn't crying. The teacher was laughing. Who was crying? Were the students crying? No one. No one was crying. Everybody was laughing. How was the teacher laughing? He was laughing out loud. The teacher began laughing out loud. Did everyone in the ER start jumping for joy? No. No one jumped for joy. Everyone in the ER laughed along with Matt. The doctor finally examined Matt and discovered he was laughing because of how little he was getting paid for his first paycheck. Did the vet examine Matt? No. The vet didn't examine Matt. Did the doctor discover anything? Yes, the doctor discovered something. What did he discover? A treasure? No, not a treasure. The doctor discovered the reason why Matt was laughing. So why was Matt laughing? Because of his first paycheck. Matt was laughing because of his first paycheck. Was Matt happy about his paycheck? No. He wasn't happy about his first paycheck. He was getting paid very little. Good for Matt. He decided to approach this situation with a sense of humor. And oddly enough, this unexpected turn of events caused everyone to burst into laughter once more. Well, this is the end of this short exercise. If you find it challenging, it's perfectly normal. You should repeat it several times, and if possible, on different days, to better understand the material. As you can see, answering many simple questions can improve your speaking, just like in a real-life conversation. This is one of the powerful techniques I use extensively in my premium courses. The courses contain hundreds of hours of questions and answers. Imagine a podcast episode multiplied by 100. I recommend you take a look at speakenglishpodcast.com/courses. Okay, we have reached the end of this episode. See you soon. Bye-bye.
Did you enjoy today's episode? Get the transcript now at speakenglishpodcast.com.